Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. According to CDC data, every 40 seconds, someone in the United States has a stroke. That's more than 795,000 people every year just in America. Thankfully, we've gotten better at treating stroke. They are survivable. But survival often then brings a new set of challenges, both physical and mental. Today, we are meeting 3 stroke survivors to get a better picture of what life is like after stroke and hopefully learn how we can all do a much better job at supporting them. But first, let's get to our morning rounds today. The Kansas City Current kicks off their season tomorrow. It will be the first time playing in the brand new stadium at Kansas City's Riverfront. Also new, this is the first season where the University of Kansas Health System is the official healthcare provider for the Current. And we are talking this morning with Dr. Lisa Vopad, the Assistant Chief Medical Officer for the KC Current, also a sports medicine specialist and the director of the Female Athlete Program here at the health system. Good morning, Dr. Vopad. This is very exciting.
Good morning.
Hey, I know you guys have been busy, your team, and just waiting for this day tomorrow and this weekend. It's going to be so exciting. What does it mean to really be the official healthcare provider for a team like this?
You know, it requires a lot of work to keep all those athletes healthy. So as you know, we did physicals more than a couple of weeks ago now. They've actually completed their preseason. So for medical care, we actually go out to the training facility. We see the athletes every week to address their medical issues, any injuries that they might be concerned about. And then certainly we're taking phone calls and on call for any needs there in between.
So as a former soccer player yourself, what's it like to not just watch this all come together, but to participate in this very, very exciting time in women's soccer?
Oh, it's amazing. You know, I remember back in 1999 when the women won the World Cup and Brandy Chastain, you know, kicked the final goal. And then to think where we have come from then, we have an entire generation now of future female soccer players that are only going to know that they can go to the professional level and play in their own women's stadiums. So I think that's amazing that that's their new norm.
So talk to those young female budding athletes. What's your advice to a girl or young woman who wants to play sports at a collegiate or maybe even a professional level someday?
I think it's to listen to and take care of your body. Females who play any sport need to resistance train and build muscle. They need to take at least a full day of rest, and they need to fuel their body. Females run off of carbs, so to keep that in mind.
All right, well, and I know you got a lot of work to do tomorrow, but also enjoy watching those ladies take the field.
Thank you.
All right, Dr. Vopad, thanks so much. Well, when we have talked about stroke awareness on this show before, we always make sure to learn and share with you that phrase, be fast. It's kind of a handy tool for remembering those common signs of stroke. Be fast stands for balance changes, eyesight problems, face drooping, arms that cannot be raised, speech problems, and then finally T, it's really the most important, time, because time is of the essence, or it's time to call 911. But what happens after someone survives that stroke, especially people in their 40s or 50s who may be raising children or need to get back to work? Here in the studio with me is Dr. Deepika Agrawal. She is a stroke survivor who also happens to be a neurologist here at the health system. Been on our program many times. Good to see you. Also next to her is Gina Jacobs, who survived a stroke 2 years ago, and she is here with her husband and big supporter, Tom. Welcome to both of you.
Thank you.
Hi. Hi. Thank you for being here to share your story. Joining us virtually, we've got a panel here with us. Kelly Schmidt. She suffered a stroke right at the height of the COVID pandemic, if you can imagine. If you remember back then, it was quite chaotic. So we're going to hear her story and talk with 2 stroke experts from here at the health system, Doctors Tiffany Barkley and Husita Vangaru, both vascular neurologists here with the health system. Good morning to all of you. Thank you for being with us. So glad we have this big panel to talk about this important discussion that might and could at any time possibly affect any of us. So Dr. Agrawal, I want to start with you. When someone is sick or injured, we throw out the term get well soon. But soon, when it comes to stroke, can have different relative meanings. So what kind of time frame should we be thinking about when it comes to stroke recovery time?
So honestly, Jessica, nobody knows the answer to that question. It can be few weeks, few months to several years.
What was your stroke recovery like?
So so I am 4.5 years out of my stroke, and my recovery is ongoing. I'm still in therapies, and I'm still improving with my right upper extremity and lower extremity.
You helped create the Stroke Survivors Support Group. Why was that important for you to do that? Where did you find that need along the journey?
So as a neurologist, I thought that I know stroke, but then being a stroke patient and a stroke survivor, that is when you live with that thing 24/7, 365 days a year. And that's when it becomes real, close to heart, practical. So just after being a stroke survivor, it became my passion to spread awareness about stroke. There are so many under-recognized and misconceptions about stroke, which is one of the leading cause of disability in the U.S.
Well, you said it's very mysterious because everybody is recovering at different times. If you know someone who's gone through a stroke, you don't quite know where they are in their process. So just helping the outsider understand is really important. Gina and Tom, I understand Gina had her stroke while you all were out of the country at the time?
Yes.
Well, how can kind of take us back to what that was like? I can't imagine being away from from your hospital and your support group going through something like that.
Yeah. So we were in the middle of a wonderful vacation in the Dominican Republic, and Gina had a stroke in the middle of the night, and I found her unresponsive the next morning, and but luckily we got her to a modern hospital, and then I had to hire a medical jet to fly her back here to KU, and it was in the middle of the COVID surge, the last COVID surge of January 20. Barely got a room here at the hospital.
It's kind of like worst case scenario.
Yeah, it was worst
You're
case
away
scenario.
from home. What was that like though? Just that morning that you found her? Did you know what was going on?
Well, I believe we got food poisoning the day before, and so we were both really ill all night long. So initially the thought was because I was severely dehydrated, and so they did some blood work, and she was severely dehydrated, and they're like, we'll give her some fluids and she'll be fine. And then eventually they realized it's something else,
So Gina, what has been the biggest challenge for you so far?
It's been 2 years since my stroke, and honestly, it's just continuing the therapy, continuing speech therapy, leg, and hopefully this arm.
You, Dr. Agarwal, have the why? Is there any connection there with the arm? The not being able to move the right arm?
So Gina and me, both of us, we had a stroke on the left side of the brain. So it affects speech. So even just like Gina, I was aphasic after my stroke, but that recovered, and both of us have significant weakness on the right side of our body.
How has she been doing, Tom, in her recovery and therapy?
It's fantastic. She's had an amazing attitude, about it. She was a positive, cheerful person before, which is, I think been very, important. And the morning of her stroke, she couldn't speak, she couldn't swallow, and her whole right side was dead. To, now to where she can walk, she's driving again. Yes, there's still struggles, but how far she's come back it's been amazing.
Come miles away. So any new routines or habits that you've put into place?
There's we do east or I stem on the arm, which is using electrical pulses.
Part of your therapy?
Yeah.
That's been helpful?
Yes.
How has it been at home? How do you carry that some of those routines and habits from therapy back into the house?
Well, you kind of learn to be a nurse and a therapist.
And a husband.
And
that's a lot.
The therapists teach you. Yes, you go to therapy, but it's 3 days a week. It's most of your therapy happens at home, to be honest.
I bet.
With you. So, but it's a team thing.
It is. I bet it's brought you two closer than you ever thought you'd be, right?
Yeah.
Has it been an emotional thing, Tom?
No. It's really hard to see your loved ones struggle on a daily basis. But we're not at the point now. I'd say we're back to about 90% normal.
Good.
So
You guys are doing
that's
good. Well, let's talk with Kelly, because it's been 4 years, Kelly, since you had your stroke. Take us back to the day this happened. How did you realize that something was wrong?
Started off the day going to the gym and work out as normal. And as I walked outside, I noticed that I couldn't see out of my right eye. It was completely blurry. I thought, weird, maybe migraine or something. I mean, I hadn't done anything. It just was like instantaneous. I couldn't see. So drove home, told my husband a little bit about it. You know, he did the whole, well, smile and see, you know, he goes, I don't see anything. I said, it's fine, going to work. I said, I'm probably going to have a migraine. I said, or haha, maybe I'm going to have a stroke. Famous last words.
Right, and we do. We use that term. You know, someone's going to have a stroke if they don't calm down or relax or do that, or you're working too hard. And then something else that stood out. You said you were going to the gym. So you know, here's a healthy woman doing everything right. You finally get to the hospital at one point, and just to note, it wasn't here. You were at a different hospital, not the health system. This was also in May of 2020. We all remember what that was like. COVID at its worst. When you left the hospital, after all of this goes through, you know, what kind of after effects were you feeling from the stroke? Kind of what was recovery like for you?
When I arrived at the hospital, I had lost my entire left side. So my stroke was on the right side of the brain. After 3 days, I had regained feeling and movement in my left leg, so I could walk. So they told me, great, you can go home. And I still had no feeling and very limited movement in my left arm and hand. The left side of my face was still numb. And they just said, go get some therapy for your hand. I didn't know there was a difference between post-stroke occupational therapy and just occupational therapy like you might get if you broke a bone and had to recover. So they just said, go get some therapy. And I asked, will it recover? You know, the leg recovered, which I was grateful for. And they just said, maybe. So
Were you doing pretty well today?
Yeah, I still have I have numbness and tingling on the left side of my face and my left arm and hand. There's no sensation. So if I put something in there, I don't always know that I'm holding on to it. So at this point, the sensory part will probably never come back. But
you're here.
I am here.
You're here, and we're glad. Dr. Van Garoo, what happens when a survivor, somebody's lucky enough to survive and get back to life, but what happens when they go home and they're not still back to that 100%, even if they're ever going to get back to that 100%? What do they do?
Yeah, so that's a very good question. When they go home and they're not back to 100%, usually we send folks home if they're able to take care of themselves to a certain extent, or they have help at home. But as Dr. Agarwal was saying, and Gina and Tom were saying, continued therapy is very important. We often underscore the importance of continued therapy. I mean, there's intensive rehab right after stroke, and we stress that a lot. But then even the recovery continues for weeks, months, and years after stroke. And we are still learning about all the neuronal reconnections that are happening. So it's very important to get either a therapist closer to you who is specialized in stroke, taking care of stroke patients, or sometimes if the patients are not able to drive or get to the therapist, we have home health care, where therapists can go to homes and then help patients. But as we already discussed, it's not more than like 3 or 4 days a week. Mm-hmm. So the really important thing falls back on the patients and the caregivers to continue therapy at home.
That's what I was going to say.
As a community, we should strive towards creating more resources. Yeah.
Right. I said you got to find a good Tom in your life to make sure that they're there to catch the ball after you get out of therapy and rehab. Dr. Barkley, let's bring you in here. Is it true that strokes are happening more and more frequently in younger people? And what are we talking about when we say younger?
Yeah, that's correct. Yeah, we've gotten better at sort of long-term stroke survival, and so you look at sort of the incidence overall per capita, especially for high-income countries, the incidence of survival is improving. But what we noticed is that the incidence of stroke, especially in the young, and we're talking young here, anywhere from any adult ages 18 to 50 years of age, and even in pediatric cases younger than that, we're starting to see increase in incidence in young patients. And if you just look at the data from the past 25 years, the incidence has doubled, anywhere from about 15 patients per 100,000 people to now about 30 per 100,000.
Do we know what's causing that? What's causing that?
There are a lot of numerous risk factors, but we think overall the most common reason is just what we call modifiable risk factors. So higher incidence of having high blood pressure, higher incidence of having high cholesterol, and diabetes are starting to occur much younger.
So both of you doctors are part of the Advanced Comprehensive Stroke Center here at the health system. Dr. Bangaroo, what do we do here specifically that you really wish that maybe other hospitals did and offered?
Yeah, as you said, since we are a comprehensive stroke center, we have the capability to provide all acute stroke treatments here, like a thrombolysis, which is a clot-busting medication, and a thrombectomy, which is a procedure where the interventionist goes in and takes the clot out, which happens in all the comprehensive stroke centers. What sets us apart is the timing, and we've created really good systems of care here, right from EMS to ED nurse who first sees the patient to identify all the stroke patients and get them to scans quickly, get the stroke team evaluate the patient quickly and deliver treatments as quickly as possible. And on top of that, since this is a tertiary center and there are 10 stroke neurologists here, we deal a lot more complex cases, and we're equipped not just at the institutional level, but personal physician expertise also. Mm-hmm. So that sets us apart from other comprehensive stroke centers.
Sure, and you use the term quickly several times in that description. We talk about how important time is. How important is getting that advanced care quickly to not just survival rates, but then just the quicker rehab time?
Yes, very important. So every second there are a lot of neurons that are dying because of lack of blood supply. So every minute counts, actually. So if every minute you give the treatment faster, it creates an important downstream effect and also determines if the patient goes home without any deficits or with mild deficits or to a rehab or to a more like a devastating brain damage and having patient go to long-term care facility where they spend rest of their life.
I want to ask a few more questions about the Stroke Survivors Support Group. Gina and Tom, I know you have attended. What has that been like? What have you gotten from those meetings? You can take your time. Please, take your time. We got all the time in the world.
You mean what kind of meetings?
With the group that Dr. Agrawal has put together, the Stroke Support Group. How has that helped you?
That has helped a lot. We have several stroke survivors, and getting to know what they do is very helpful. And plus, they provide information that we didn't normally have.
So Gina, you're getting the education, and then you're getting to meet people and become friends with people who've gone through what you've gone through.
Yes.
Tom, what's it been like for you as the supporter, as the husband?
Yeah, I mean, it's good to. I think it's important for Gina, like she said, to because you do get somewhat isolated, and
Yeah.
no one in my family's ever had a stroke, and so like Gina, you know, I mean, we've learned a number of things, you know, and it's just good support for Gina.
I bet, I bet. And again, for the supporters too. Kelly, what have you gotten from this support group?
Just kind of comfort in knowing that I'm not alone. I mean, no two strokes are identical. We all, even if you've had the same kind of stroke, you don't necessarily have the same deficits or had the same outcome. But just in talking to other people who understand the frustration of having your entire life turned upside down in a matter of minutes, and trying to get back to some resemblance of normal. It took me over 2 years. Part of it was due to the pandemic, but it took me over 2 years to find a support group. Stroke makes you very emotional. So it's nice to be able to talk to someone who can truly say, I understand. Even if it wasn't the same stroke, they've been through a lot of the same things.
Sure. And you said it, no two strokes are created equal. Dr. Agarwal, are these stories the stories that you would hope to hear after creating this support group?
Yes, I mean, it actually gives me peace, or that I have been helpful, I have been useful for someone.
Oh, you have been in all sorts of ways. So if you're watching and have any questions yourself, please send those in to the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. The information is there on your screen. Let's check in with Dr. Dana Hawkinson on this Friday. Good morning.
Hi, how's it going?
Hey, good. What's the COVID count heading into the weekend?
Yeah, so we had, again, low numbers of active COVID infections in the hospital. That is good. We have 12 active patients right now, no critical or severe illness. So overall, that's good. And we will see what next week's numbers are, as well as update the community on our influenza admissions as well. So.
All right, keep us updated on that. But Hawk, today marks the very first Long COVID Awareness Day, and we know it's still a pretty mysterious condition involving many different symptoms across the board. But what do you know about ongoing long COVID research?
Yeah, so long COVID is real. We know it affects people every day. I'm sure we all know one or two or more people that have effects of long COVID. And just like you said, it can have many symptoms. So it can affect many organs in our body. So the brain, the lungs, even the GI system, the muscles. What we know is that it is a very high incidence issue or problem around the world and in our communities. Per the NIH, there are as many as 23 million Americans that may have symptoms of long COVID. Now, the problem is it is a chronic issue. It can last weeks or months or longer. And remember, for long COVID, you really need to be diagnosed when you have continued symptoms at least 30 days or 4 weeks after your initial onset of the illness. We are beginning to look at and ask the questions on why does this occur and what is going on in our bodies. We know that there is a lot of research going on. We know NIH has pledged money to it. At KU, the University of Kansas Medical Center, there is heavy involvement in long COVID research, and it is called RECOVER, and that is in all caps, RECOVER. And then also launching symptom-specific treatment and trials. And why is that important? Just because we said, again, symptoms are so different and they can affect different parts of the body, so you're going to have different symptoms depending on what part of your body is affected. There is a RECOVER Neuro, and that is for neurological symptoms. A lot of people have brain fog or continued headaches. There is RECOVER Vital, looking into the immune system. One of these things that they are also looking at is continued use of Paxlovid or longer-term use of Paxlovid, helping with the immune system, maybe reduce ongoing replication. That is one of the theories, is maybe there is some ongoing replication of the virus or pieces of the virus that continue to lead to immune activation, causing some of these symptoms. So if you are feeling ill, or you know somebody that is dealing with long COVID symptoms, again, generally we want those symptoms to be present 30 days or more after your initial infection. please check out recovercovid.org for more information. And what I would say is we also had a long COVID clinic at the University Kansas Health System. There was overwhelming response and need for that. We don't have that specifically anymore, but what we do is generally tell people to start with their primary care physicians, and then with their primary care physicians, they are able to refer to that specific subspecialty which may be needed. For instance, headache and brain fog would be referred to neurology. If you had continued cough or shortness of breath, you would be referred to pulmonary doctors or lung doctors. If you had continued lack of taste or smell, you'd probably be referred to ENT physicians as well. So that is what we are recommending for that. But overall, just remember recovercovid.org if you're looking for more information to be a research participant.
Dr. Hawkinson, thanks so much for the information. Let's get to some questions from our viewers this morning. Dr. Barkley, question, stroke seems unpredictable and random. Is there anything that can be done to prevent stroke?
Yeah, that's a very good question. I think that, the biggest risk factors for stroke, what we call modifiable risk factors again. And so that's things like, having high blood pressure, high cholesterol. So really important to be mindful of our diet, to make sure that we're exercising. If you're smoking, if you can quit smoking, that would be, great. So all those things, make sure we have a healthy heart and healthy body.
How did Dr. Agarwal know that she was having a stroke, or did you?
So I did not know that I was having a stroke. So in fact, I was at a restaurant all by myself, and I was luckily at that time I was texting one of my colleagues, Dr. Brennan Biddle. Of course, she's a neurologist, and I was telling her that my head is exploding, it's hurting, and I'm not thinking, I cannot think straight, but I thought that I was having a bad migraine. And I've had that in the past in the clinic in front of her, so she knew that I have history of migraine headaches. And so then she said that, okay, I'll check on you in 15 minutes. And by the time she checked on me, I was slurring my words. I had a facial droop, so she called 911 and then called the stroke team in the hospital.
She did all the right things. Gina, do you remember in the moment having a stroke? Did you remember something was going wrong?
Well, as Tom said, we were both sick before, so that came out, and I didn't have any water, but I woke up and I remember feeling the way with the right side of my body,
You knew something was wrong. Just
Yes.
you didn't know what it was.
Yep, but I can tell them. Anyway, so I was in the ambulance, and I remember, but I couldn't tell anybody.
Yeah, that's really frightening. It's almost like you're kind of trapped in your own head. You know something's wrong. You're alert. You know something's wrong, but now you can't even communicate what's wrong. That's really, really frightening. Dr. Barkley, what's a mini stroke?
A mini stroke, you'll often hear that term, but we call it, a TIA or transient ischemic attack. And that is a stroke, and we treat it like a stroke that's more permanent, but one with temporary symptoms, usually lasting less than 24 hours, and that resolves. And then a lot of times when we do imaging, like an MRI, we don't find any long-term damage that we can visibly see from the stroke, but we know that underlying there are risk factors, and it does predispose you to a larger stroke or more permanent stroke in the future.
So kind of a combo question from Joellen and Paul. Is there a test or a scan to check your stroke likelihood? Are there any genetic factors that pertain to having a stroke?
That's a good question. Unfortunately, no. There's not, there are certain underlying genetic disorders that do increase your risk to have stroke. For example, sickle cell disease and some inheritable or acquired thrombophilias or hypercoagulable disorders, meaning that the way the blood clots is faster. But no, there's not a particular test that can, show you an increased risk for stroke. other than, you know, kind of what we talked about before. If you have high blood pressure, if you have diabetes, if you're a smoker, if you have high cholesterol, those things can all increase your risk to have stroke.
Okay, does stress cause stroke?
Stress over time, we know that leads to increased sort of inflammatory cascades in the body. So certainly stress over a long period of time can increase your risk to have stroke.
All right, that was a personal question, but I'm sure it applies to many other people. But just check in on this Friday. Kind of do a little stress test on myself. I want to get our takeaways today. And Dr. Barkley, let's stay with you. What do you want people to take away from this conversation?
I want to just to put out there that anybody can have a stroke, whether you're young, whether you're old, whether you're relatively healthy, or you have risk factors. And so no one is immune to having a stroke. So just being aware of stroke symptoms and the need for urgent treatment and evaluation is important.
Dr. Bangaroo, what's the takeaway today? Oh, I think you're muted.
Other than the things we already discussed about getting to the hospital as quickly as possible, I want to stress about importance of continued therapy. Even after patients go home or patients get discharged from acute rehab, which is just for 2 to 4 weeks, and once they go home, it's not time to give up. There is a lot of hope still, and continued therapy will help in continued recovery. And we've seen a lot of patients, and Dr. Agarwal is a live example here where she continues to improve several years after her stroke.
Thank you so much for your insight today. Kelly, what do you want folks to take away from your story?
I guess when you do go home, if the information has not been provided to you, seek out a support group. Seek out maybe counseling. It's a very emotional and mentally draining thing, even years into it. So the more support and research you can, find and have, it's just, I don't know how to explain it. I guess just getting that reassurance that you're not alone, and that there is someone out there that can help you.
Tom, what's the takeaway from a supporter's perspective?
Just hug your loved ones every day, because you never know. You go to bed, and the next morning your whole life has changed. So.
How are you doing?
Good.
You're doing good.
Yeah,
Okay. We've got to check in on folks like you too, right?
Yeah.
You bear the weight sometimes, right?
Yes, it can be very exhausting.
Yeah. But thank you for being here with us today. And Gina, what is the takeaway from your story? What do you want people to know?
I'm just happy how we're to be here.
We're happy to have you here. So thank you for being with us this morning. And Dr. Agarwal, I'm going to have you wrap us up because I kind of find you responsible for this big group of people gathering today and providing the support that clearly is needed for so many people. What's the big takeaway?
Well, I just have one takeaway message for everybody. Stroke is preventable, treatable, and beatable.
Yeah.
So there is life and hope after stroke.
Love it, love it. Thanks to everyone just being a part of this very, very important discussion. Okay, so pop quiz for the audience. You remember, be fast. I mean, write this down, put it on your refrigerator. Just really, really, really drill it into your brain. Here it is. Be fast. Balance, eyes, face, arms, speech, and again, time, the most important. Time to get going, time to make that call to 911. So on that note, we're going to leave you with something pretty fun today. A peek at some of our babies that are in the NICU who have already they're in the soccer spirit already ahead of the Kansas City Current matchup tomorrow. So take a look. Have a great weekend. Coming up Monday on the Morning Medical Update. New drugs and diagnostic tools promise to change Alzheimer's disease. But do they live up to the hype? I'm Jessica Lovell. On the next Morning Medical Update, we sit down with one of the country's leading Alzheimer's researchers who's already using brand new treatments with patients. Plus, the simple ways to protect your own brain health. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.